often talk about our health system, but have we lost sight of what it really means? Let's explore how we restore the system in our health system. First, let's consider what we mean by health. It's not just the absence of illness. According to the World Health Organization, health is the complete physical, mental, and social well-being. It's a holistic state that affects every part of our lives. And now, what is a system? A system is a collection of interconnected parts that function together as a whole, where every part influences and is influenced by others, creating this complex web of relationships. So when we're talking about our health system, we're talking about an intricate network of people, services, policies, and resources, all working together to promote the well-being of individuals and communities. So how is our health system doing? In 2016, the Institute for Clinical Evaluative Services reported that a mere 5% of individuals in Ontario accounted for a staggering 64% of healthcare resources. Essentially, a very small fraction of patients with chronic disease and complex medical care needs are using the majority of our health care resources. And this is only accounting for the traditional hospital and medical services, the most expensive ones. Recently, the Ontario Hospital Association reported that by 2040, 1 out of 4 individuals over the age of 30 would be living with a major illness. This is up from approximately 1 out of 8 individuals back in 2002. Our health system is already in crisis. Access to care is becoming increasingly challenging. Our healthcare workforce is burning out, and many are choosing to leave the sector altogether. If we don't change how we approach these issues, they'll only get worse. And these issues aren't new. They haven't just sprung up on us. We've been talking about some of these issues for decades. So why have our efforts to address these issues failed? Here's the problem. Too often, we've treated the health system like a machine, focusing on individual parts without considering how they interact. We fix one part at a time, and we expect the whole to get better. But we're missing the bigger picture. And this is not surprising. Traditionally, medicine has approached the human body like fixing a car. If something didn't work, we patch it up, we replace it. And while this worked for acute issues like a broken bone, it overlooked the connections that influence our overall health, like the impact of stress on our bodies, or the importance of strong social connections. We now know that social isolation is as harmful to our health as smoking. Our health system issues aren't simple issues we can fix the same way we fix a machine, by replacing the broken gear, or by giving an Advil to address a headache. And they aren't complicated issues that we can fix by hiring the right expert to reprogram the firmware or to conduct open heart surgery. Our health system issues are complex, and they require us to experiment, to discover solutions that are emerging from the system through continuous learning and adaptation. This complexity of the health system is what made me decide to leap from management consulting to working in the health system. In consulting, we brought large groups of individuals together to solve complex issues. And after a few sessions related to health system issues, it fueled my passion to bring this work into the health system. I saw opportunities to make a real difference, and I thought that my skills and experience would be welcome. Instead, I felt like an outsider, speaking a different language. Some of my ideas were met with a puzzled look, as if I brought a defibrillator to treat a sprained ankle. Some people wondered, what is she going to do with that? And because I wasn't a doctor or a nurse, how could I possibly know how to help improve our health system? Well, sometimes when that real crisis hits, that defibrillator, or a different way of thinking, is exactly what's needed to revive the system. Let me ask you, raise your hand if you have health concerns about someone you care. Raise your hands again if you have ever visited a doctor, received treatment from a nurse, or talked to a pharmacist. Okay? Now raise your hand if you've ever changed your eating, exercise, or sleeping habits to improve your own health. And lastly, raise your hand if you or someone you know has experienced a challenge with the health system. See, we're all part of the health system. We are the health system. We're not just spectators. We are participants, being shaped by it and contributing to it. And whether you're a patient, a caregiver, a health professional, an administrator, a policymaker, or a community member, your perspective matters. So if the health system is more of a system than a machine, then we need to improve our understanding and competencies of addressing complex issues within systems. We've been conditioned to look for simple cause and effect relationships or identify root causes. But our health system issues aren't that predictable, and there isn't a single root cause that, if fixed, would solve all our problems. By focusing on those quick wins or low-hanging fruits, we limit our ability to understand what is truly happening. We need to dig deeper. By recognizing that the health system is part of an ecosystem of systems, we open ourselves up to solutions that are more appropriate. It's like putting on reading glasses or bifocals after we reach a certain age. At first, putting on those system lenses can feel overwhelming. We see more details than we used to. But over time and with practice, we see better through those lenses. So let's explore a few key concepts of working in complexity together. And to do so, I would like to introduce you to Jordan. He might resemble someone you know, a distant uncle perhaps. Jordan is diabetic, showing signs of heart disease, and is obese. He lives in a low-income housing unit, and over the summer, repeatedly ends up in the emergency department, showing signs of dehydration and heat stroke. This worsened his health conditions and cost our health system a lot of money to get him back home. So how do we help Jordan using a systems approach? Let's explore these concepts together. My first lesson of working in systems is that the interactions between the parts are more important than the parts themselves. Jordan has multiple health providers who might all be excellent individually within their professional scope of practice, but without effective interaction throughout his journey, his health suffers. And Jordan is following the advice of all his health professionals, but still ends up in the emergency department on those hot summer days. Focusing on the role of the clinician is focusing on the parts. So how do we leverage the connections within the system to help Jordan? Well, we don't have a great health data system that allows for seamless sharing of information amongst providers, making these connections more challenging, or worse, expecting the patient or their caregivers to repeat their stories and keep all their files in order. And providers who work across different organizational structures can't easily interact with each other. It's like we've accepted blood clots in our system. Similarly, across the country, when we're trying to redesign our health system, some provinces are choosing to centralize all their operations into a single health authority, while others are splitting them up in smaller parts. And despite this shuffling of chairs on the deck, there's very little conversations happening about how those parts are expected to connect and interact. We are more focused on the structures than on the connections that are essential to make the system work. The second lesson of working within systems is the importance of obtaining a diversity of perspectives. We make decisions based on the information and the knowledge we have. So when Jordan and his team of health professionals came together to share their knowledge and perspective of what was going on, they discovered the issue to his heat strokes. His apartment became extremely hot during those summer heat waves. The solution? They bought him an air conditioning unit, keeping his home cool and preventing him from dehydrating. But you might ask, wait, is buying an air conditioning unit healthcare? Well, if it improved his health outcomes and cost less than the alternative, then why not? So similarly, when we're trying to solve health system issues, it's important for us to bring people with diverse background, experiences, and roles. Patients, caregivers, health professionals, administrators, policymakers, community members, all hold invaluable insights. And by bringing their collective knowledge together, we're way more informed to come up with more appropriate solutions that work for everyone. The third lesson of working within systems is recognizing that systems are constantly evolving. There's no one-size-fits-all solution because the landscape is always changing. While I value evidence-based practices, it's important to recognize how the environment has changed and the context. Sometimes there might be no evidence for what needs to be done, and we must be willing to experiment. So coming back to Jordan, while buying him that air conditioning unit worked at that time, what happens if the local grocery store that sells fresh fruits and vegetables closes? Jordan will need help from his team to get access to the nutritious food he needs. And leaders who recognize that the system is always evolving, they know we're not part of a marathon. We are navigating an ever-changing landscape. And sometimes what used to work previously may no longer be effective, and adapting is essential. Just as trees lose their leaves to endure the winter, we must be willing to let go of outdated practices that no longer serve. By recognizing that systems are always evolving, we need to get better at implementing good enough solutions more quickly and adapting them as the circumstances change. Let me share another example that brings all of these concepts together. While I was serving on the board of a community health center, I learned about this amazing assertive community treatment program. This program served individuals with severe and complex mental health issues by assembling multidisciplinary teams responsible for providing personalized and comprehensive care, ensuring that patients didn't fall through the cracks. They knew how all the connections worked. And despite demonstrating significant cost savings from reduced emergency and inpatient services, this program struggled to secure the funding it needed to sustain or expand it. And this issue isn't unique. It's a reflection of the broader challenges in how we've designed our system. We've made it hard in the way we've structured our system to allocate funding to where the needs are or to areas that might have more impact. Solving the issues of our overcrowded emergency departments will require solutions from outside the emergency departments and even from outside hospitals. We need more systemic solutions, like ensuring that every patient has access to primary care, as advocated by Jane Philpott. Remember Deming's words, "A system is perfectly designed to get the result it gets." So if we want different outcomes, we need to redesign the system itself. What if we design a system that keeps people healthy, not just treat them once they're ill? What if we design a system where we allocated resources where they had the most impact? Right now, we're investing heavily in the most expensive part of our system, leaving community and primary care under-resourced. This approach fails to address issues before they escalate and does very little to help the health of our communities. As many have said, we have a sick care system, not a health system. By embracing a systems approach, focusing on interactions over the isolated parts, valuing a diversity of perspectives, and recognizing that the system's always evolving, we can make meaningful change. And we all have a role to play in it, whether you're in healthcare or not. By listening, adapting, and navigating complexity, we can transform our health system into one that would serve the well-being of everyone. It won't be easy and it won't be quick, but I believe it's possible. As Einstein said, we cannot solve problems with the same thinking that created them. So I ask, what role will you play to restore the system in our health system? Thank you.